My name is McGuiness. I'm a owner of Aspire Physical Therapy in the greater Los Angeles area. We have 3 locations with 4 to 5 treating clinicians. One of our residents, Brett, brought in one of the first models of the NecksLevel, and he kind of left it off in the corner on his desk, so he used it once in a while. The rest of us just saw it. And then I think I had a patient with chronic headaches and a lot of neck stiffness that I was working through. And then once I got through some manual treatments, we really want to focus on proprioception, and we did some laser proprioception work. And then I decided to get the NecksLevel out and work isometrics. And then we progressed to some proprioception with the laser on as well. And that patient saw results within 24 hours. So from then on, I started saying, this is my next thing. The newer model, we could really dose it by which level of the TheraBand color we were using, the extent at which you deviated the board for isometrics, stuff like that. So that's why I thought that the second model was really appropriate for us. We treat a lot of cervical spine and headaches in here. And so I'm big on cervical proprioception, isometric training. This really went well with our laser training or different games we play on the wall, along with strengthening the muscles. I don't think there's any other device like the NecksLevel in an outpatient orthopedic clinic. And when I say that, I mean, we have TheraBands and stuff like that we've used for years, but you see people all the time having a TheraBand around their head and pulling it to one side, or leaning a chair away and trying to do isometrics. And it's really just not that functional. And it's not something they're going to go home and do at home. So this is another way they can come in and do their sets and do their reps and actually get strengthening in the muscles of the cervical spine. They feel the difference. They feel the true rotation and how to stay in one plane and not how to deviate, which is really great as far as teaching this proprioception idea. It's something really practical in the clinic, easy to set up. Therapists set up the first time, the aides can help from there on out. It's a wonderful device. One word that a patient said the other day, after they get up from using it the first time, we have them go through their motions, whether it's side bending, rotations, and they feel like they're floating. They feel like it's a lot easier to move. It's kind of like after doing a lift, you put down the weights or the rubber bands, and all of a sudden you're like, oh man, my joint feels light again. So that's kind of the feeling a couple of them have said. And then we just noticed the quality of motion improves a lot. They stopped having like compensation movements. Instead, they're spitting straight in the plane we want. Each clinician probably uses it at least once a day. So if they have, they're treating 10 to 15 patients in a day. Let's say they have 1 or 2 cervical spine patients, maybe they're probably using on 1 out of the cervical spine patients. So we have it sitting out in one of the drawers out here in the main floor of the clinic, and easy to pull out and throw around in the treatment tables. I think the NecksLevel is just a great follow-up for what we do in physical therapy as far as manual treatment. We can do our manual, we can do it great, but it's only as good as what they can then turn into their motion and use their muscles to maintain. So I think it's a great way to follow it up with some kind of therapeutic exercise without sending them off to the wall to try to do isometrics or something like that. It's really cool to see the NecksLevel's progression of different prototypes and how functional they're getting and how light they're getting and stuff like that. So keep making them better and better.